such drugs, heroin, cocaine, amphetamines, but also because of risky sexual behaviors. In different countries, we have heard that there are an emerging problem of youth violence, criminalization related to this use of cocaine.
I think that you have at least 1.25 million Ghanaians who have problems with drugs. Most of it is marijuana, but about 1.25 million, because we have done there has been a survey, school health survey, amongst students in second cycle institutions, and those who have tasted drugs at least once, the percentage is 23%, which is very alarming. And this survey was done in 2007. It was not just done by the Ghana Education Service. The project was sponsored by some U.S. agency with the support of World Health Organization, and the results are out. Divided Ghana into southern, central, and northern. Indeed, what is alarming is that in the north, the percentage of girls was 36%.
ECOWAS member states have responded to this creeping human disaster with some seriousness. Virtually all countries in West Africa have anti-drug policies to see how they can save the situation. These national policies largely place emphasis on the supply side, whose main thrust is stopping illicit drugs from getting into their respective territories. So, drug agencies across the region are battling barons, but local consumption is attaining what is now being referred to as an epidemic level. Without curtailing local demand, the drug scourge in West Africa could spiral out of control. Most countries do not even know the magnitude of the problem because data is not readily available. Drug demand control entails the generation of all relevant data on illicit drugs, as well as the prevention and treatment of drug abuse. This is the only way to save the many lives that are hanging by the thread in West Africa.
Now I need help. If I get help, I'll stop. Why? Because of drug. My wife leave me. Then get 4 kids.
I dream about to have a better life, live with my wife and children and family in the house, comport myself. You see, but because of the drug, I found it very difficult because I've not stopped.
Unfortunately, not many countries in West Africa are equipped to do this. Richard Arma and Richard Opare are 2 former addicts who were lucky to find a way out of the drug maze. Many others across West Africa are still lost in it.
All that I was doing was just to smoke the drug and just wasting my life. And I had to be sleeping in slums, stealing, doing all sorts of things just to get the money to smoke.
When I had become an addict, willpower was not working any longer. I went to so many hospitals, including the psychiatric hospital. I ended up in so many Christian rehabilitation centers, to the extent that at one point in time they wouldn't take me any longer because it was like I had come there too long or too many times. But one thing I did, which I believe that helped me a lot, was that I kept praying to God, the God that I didn't have very much understanding of. I kept praying, and it's very unusual with an addict getting up, especially at dawn, and praying.
In our country here, we have 1 or 2 or 3 places where they treat addicts, but then it is not good. The government has to set up a place where even if an addict wants to come out of it, it should be free.
The 2 Richards belong to civil society organizations who have the right to help addicts fight their addiction as they fight for their lives. The Kolebu Teaching Hospital, Accra, Ghana's premier medical institution, has a psychiatric unit. Here, Richard Opare volunteers time counseling addicts.
When we're looking at who is an addict or where addiction is, we realize that it's a kind of illness, let me put it that way, or sickness, which is progressive and which starts from somewhere and ends somewhere.
It is one of the very few of such government facilities in Ghana. Another facility for rehabilitation in Ghana is at Patan Hospital. Residents, as the inmates here are called, pay a monthly fee of 600 cedis for a stay of 6 months. The Patan facility employs a unique program known as a therapeutic community, where every member of the community is responsible for the recovery of the other. So, as a family, they work pulling each other up on the long and lonely road from addiction.
Initially, it was difficult. It wasn't easy for me here because I came here as a full-blown addict.
We do not use drug in treating addiction. So what we do is that exercise is part, so that as you work out your body, the excess of the drugs in your tissues could wear off by themselves naturally. So far, we started this program on the 9th of September 2009. I think we're almost 2 years gone. And the success rate has been great.
At the community center Granja San Felipe in Cape Verde, a similar approach has been adopted for the treatment and rehabilitation of drug addicts. There is, however, one fundamental difference. The gates here are not locked, so the inmates know it is a matter of choice. Since the center opened in 2005, none has escaped, and over 60% of those that left here after the 9-month program have stayed clean.
This house have a good name in Sal Island because I have many people, friends of me. I used to use drugs with them together, and they used to use more drugs than me, and right now they have 3 years, 4 years clean. They have the job right now, they have the family, the car, everything, so that's why I see in my friends what they used to do what they used to be before and what they are right now. That's why I'm here right now.
Every day at the center starts with a recitation in which the residents remind themselves of why they are there and why they have to look in the mirror and confront the demons that have been chasing them, literally.
We work in group. The most important here is not the technique, it's us. And all of us want to help together, each other. And me, I understand you, what is your problem, and I try to help you. I try to help you to tell you the better. And the techniques, the psychologists help us so much, so much.
The structure of the center is probably the most integrated in West Africa. There are standard group therapy sessions where inmates work together with in-house specialists, and sometimes former inmates return to support them. There is also something else. The inmates, as part of their preoccupation, cultivate banana plantations. The harvests are processed by them into products such as chocolates at an in-house facility managed by a reformed addict. The products, which they proudly show off, are sold and proceeds retained to fund the center. The inmates also produce artworks and other creative pieces which are also marketed for revenue.
Será que se Granja abriu na 2005?
Sometimes I question myself, if in 2005 the center was not open, would I be alive and well today? Would my children be as happy and living a peaceful life as they do today? I have to recognize the value and success of this center. After living for 17 years as a drug addict, I still don't sometimes believe I could live the life I have today. I thank the center and God for today.
This is good news for a country that is paying attention to the uphill task of surmounting the drug scourge.
I said maybe about 90% of the crime people do is because of drugs.
As a result, at the Central Prison in Praia, much attention is given to the sensitization of inmates. This is one of those sessions, and Dr. Venusa Pereira, employing an interactive approach, has gained the confidence of the young inmates. This approach has worked so well that it has positively affected the number of released prisoners who return to the prison.
2 years ago, we used to have a lot of prisoners to come back. You know, they get out of the jail and they go to their house